One in five Americans have said that they've used up their savings or lost their main source of income because of the ongoing pandemic. Now, we've all known that COVID-19 has has taken a cruel toll on the health of a lot of older Americans. Now, a new study from the Commonwealth Fund Foundation finds that the coronavirus has been equally and brutal financially. In fact, the 2021 International Health Poll survey, the health policy survey of older adults, showed that Americans that are 65 and older, they have been facing greater economic hardship and healthcare disruption than people of their age in 10 other wealthy nations, in some cases far greater than that. The findings were released a day after the U.S. Census reported that median household incomes for the Americans 65 and older fell by 3% from 2019 to 2020. It's now roughly 46,400, said David Waddington, who's the chief of social, economic, and housing statistics at the census. The median household income dropped by 2% for those that were under 65 years old. Some 9% of Americans that are 65 and older are now living in poverty, and half of the Medicare beneficiaries have incomes below 30,000, according to the National Council on Aging. Excuse me. Another new international survey from Natixis, I'm not sure if I'm saying that right, investment managers named the U.S. number 17 in the world for the retiree well-being. Iceland was number 1 for the third year running. America's rank is down a spot from last year. The survey's respondents of individuals with at least $100,000 in investable assets said that COVID-19 has made retiring securely more difficult. In addition, the Commonwealth Fund president, David Blumenthal, said during a call with the media in the U.S., Black and Hispanic older adults suffered disproportionately from the pandemic's economic fallout. The Commonwealth Fund surveyed 18,477 adults that were 65 and older, and they combined them from March to June, and they talked to people in Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, the United Kingdom, and the U.S. among its stark findings. 19% of older Americans reported that they used up all their savings or lost their main source of income because of the pandemic. That's 4 to 6 times the rate in Germany, Switzerland, the Netherlands, and Sweden. Nearly 4 in 10 older Hispanic adults and 1 in 3 older Black adults said that they experienced economic difficulties related to the pandemic. By contrast, it's 14% of the older white adults that said so. 37% of the older Americans with 2 or more chronic conditions had reported pandemic-related disruptions in their health care. Compared with all the other countries in the survey, they were the most likely to have medical appointments canceled or postponed due to the pandemic. In Germany, for instance, just 11% of the people 65 and older reported such results on this. The Commonwealth Fund says 68% of its U.S. respondents have reported having 2 or more chronic conditions. 42% had 3 or more, significantly higher rates than the other 10 countries and slightly lower than the percentages for Medicare beneficiaries in the U.S. overall. 23% of Americans 65 and older who needed help with activities of daily living during the pandemic, like eating or getting dressed, didn't receive such help because caregiving services are canceled or were very limited. Only people 65 and older in Canada and the United Kingdom had things worse, 31% and 30% respectively. Now, all of these findings are despite our nation spending the highest percentage of its gross domestic product overall on the health care. Either it's going through traditional Medicare, private Medicare Advantage plans, or Medicaid. In fact, a person named Sharon Stern, who's the assistant division chief for employment statistics at the census, said on Tuesday, September 14th, that its new figures showed just 1% of Americans 65 and older lacking the health care insurance that they need. The percentage who aren't insured is slightly higher than the 0.9% that was back in 2018. Still, Reginald D. Williams II, who's the Commonwealth Fund Vice President for International Health Policy and Practice Innovations, at the end of the day, he said that despite having health insurance, older adults in the U.S. face higher economic challenges compared to those in other countries. Very few older Americans surveyed said that they weren't planning to get COVID-19 vaccinations. The vaccination story overall was pretty positive, said Williams. But Blumenthal noted that one of the advantages of comparing just Americans 65 and older with those of the similar age in the other countries is that Medicare is the closest that the U.S. comes to having the kind of national health insurance that other nations have for all their residents. He called Medicare a critical lifeline for Americans 65 and older, but also said that it's a flawed program with significant gaps for vulnerable beneficiaries. Because of those gaps, Blumenthal said, some on Medicare have sizable out-of-pocket health care expenses. We could make Medicare more affordable by putting the caps on out-of-pocket costs and by covering more of the health services, including dental, vision, and hearing. Sadly, almost half of the Medicare beneficiaries didn't see a dentist in the past year, or they don't have dental coverage. The National Council on Aging reports. Now, legislation that President Joe Biden has proposed and is under discussion by Congress would add dental, vision, and hearing coverage to Medicare. The vision coverage would begin in October 2022, and the hearing coverage in October 2023, and the dental coverage in January of 2028, according to the National Council on Aging's Howard Bedlam. And this is history in the making, said National Council on the Aging Chair-elect Kathy Greenlee, who's the former Assistant Secretary for Aging under President Barack Obama, speaking about the potential for broadening Medicare during an online panel discussion Wednesday. But whether any of those Medicare reforms will become law is far from certain. Already, medical and dental lobbying groups are fighting the proposed extra coverage, fearing lower reimbursements to physicians and dentists. Now, some Republicans believe that the added coverage would be too costly for the U.S. government. A 2019 proposal to add dental, vision, and hearing to Medicare was estimated to cost $358 million over a 10-year span, according to the Brookings Institute. The Commonwealth Fund's report concludes with this call to action. The U.S. has the means to take steps to reduce this kind of burden on older Americans to ensure that their health needs are met first. Now, the Foundation's researchers say that the U.S. can do more to help older adults meet their health care needs by improving access to the health care services and integrating them fully with the regular primary care, further improving the economic security of the older Americans and addressing the racial and ethnic inequalities that the pandemic has exacerbated. Now, if you like the video, give the video a like and subscribe to my channel, RBW King, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.